So this afternoon, a couple from that cruise ship linked to that deadly hantavirus outbreak is now back here in Atlanta. So we know that at least 18 Americans from that ship were taken to Nebraska, where the university's medical center in Omaha is currently keeping 16 patients in its national quarantine unit. 2 patients landed this morning in Atlanta to be monitored at Emory University.
So we followed the team from the airport to Emory University Hospital with our 11 Alive Sky Tracker. The 2 passengers from the cruise ship now here are from Georgia, so finally back in their home state, but their ordeal is not over. Again, we streamed this all for you live streaming from our studio today. 11 Alive's Grace King joining us live from Emory University Hospital now in Decatur.
So Grace, what do we know so far about these 2 patients there at Emory?
Emory says this is what their serious communicable disease unit was built for. They said they helped Ebola patients back in 2014 and are ready to help any possible hantavirus cases now. They say they're monitoring 2 passengers from that cruise ship, one with symptoms and one without, and are ready to treat them if necessary. On Monday, a high-security health response touched down at Hartsfield-Jackson Atlanta International Airport.
I mean, this is a system that exists for exactly this kind of scenario, and what you are seeing is the system working. The system kind of will absorb passengers as needed, and this is a very well-rehearsed system that exists. Video shows health officials greeting a couple from the MV Hondias cruise ship on the tarmac before transporting them to Emory University Hospital. So it is a couple, but because of their situation on the ship, they were traveling together to Emory. In a statement, a spokesperson for Emory University Hospital said it is part of the Regional Emerging Special Pathogen Treatment Center network, which provides specialized capabilities for safely managing high-consequence infectious diseases. They said one symptomatic individual is receiving care in Emory's biocontainment unit, and one asymptomatic individual, identified as a close contact, is undergoing evaluation and monitoring.
We do think that being able to provide those aggressive measures to people can change outcomes, and that's the importance of being close to this type of care and to be able to provide that critical care for individuals should they need it.
And this morning, those health officials said while there are no guarantees in life, they're putting as many precautions and safety measures in place as possible to keep the community safe and healthy. They said at this time they do not believe there is any risk to the public. Live at Emory University, Grace King, 11 Alive News.
Which is really good news, Grace. Thanks a lot for the update. By the way, at an event today, Governor Brian Kemp says that he believes all Georgians will be safe if someone is sick with hantavirus because Emory is fully prepared.
And there is nobody better to handle that than the folks at Emory. You think about how they've dealt with folks that had Ebola that had been transported back here. And we're going to do the right thing. We're going to help get these people back and get them in the right environment that doesn't put our fellow Georgians in jeopardy.
Now, Governor Kemp is referring to the 2014 Ebola outbreak. Emory treated the first patients diagnosed with the virus in the United States after both were infected while doing humanitarian work in West Africa. And at that time, doctors used experimental treatments, and within weeks, both patients were declared Ebola-free. Emory would later go on to treat at least 2 more patients.
There is growing interest in this story. With that, more conversations online. I talked with Dr. Felipe Labello on our 11 Live stream today about misconceptions and misinformation. He says a lot of it stems from unfounded COVID comparisons.
Hantavirus is not COVID. This doesn't have the potential to become a pandemic or large-scale outbreak because of the nature of the virus, because it requires really close contact, because it's not as easily transmissible as COVID. But it is a wake-up call that we need to have these public health systems in place. The funding of the public health authorities, unfortunately, has been slashed over the last couple of years. So this is making more difficult the job of public health and authorities to control not only this outbreak, but potentially future outbreaks, because we know those are going to happen.
Dr. Labello also said it was more difficult to coordinate the evacuation of passengers representing more than a dozen countries because the United States is no longer part of the World Health Organization. But talking with reporters this morning, President Trump says he does not regret leaving the WHO.
Do you regret withdrawing from the WHO? No, I'm glad. So we were paying the World Health Organization $500 million a year. Look, it's a lot of money, but in the overall scope, it's not that much, but it's a lot of money. And we weren't being treated well. They gave us all wrong information. On COVID, they were totally wrong.
The president signed an executive order to leave the organization in 2025. The U.S. completed the withdrawal in January of this year. The president says he believes the country is, quote, in good shape to handle the virus.